Good morning, good morning. I'm Dr. Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, this is your daily medical tidbit. I'm going to keep it in the same vein as the last several topics. This is uterine cancer. All right, uterine cancer and endometrial cancer is the same thing. All right, that originates in the inner lining of the uterus. Okay. That's called the endometrium. Thus the term uterine endometrial cancer, so within the uterus, right? So it is one of the most common gynecological malignancies in women, all right, especially after menopause. Remember that. But what we've been seeing is a steady rise in both the incidence and the mortality. All right. But like I've stated with all the other cancers, the burden is not equally shared because black women are disproportionately affected. Higher death rates, more aggressive disease, delayed diagnosis compared to other women. Okay, so endometrial cancer represents the fourth most common cancer among women. And my data is from U.S. data, okay? So it's breast, lungs, colorectal, then endometrial, all right? And each year, there's more than 65,000 new cases, guys, and 12,000 deaths occur annually, all right? So we have to be aware of that. Awareness, and take a stand and figure out what's going on, because the mortality rates in black women are 90% higher than in white women. And that's American Cancer Society and NIH data. Black women are more often diagnosed with different subtypes that are more aggressive and less responsive to treatment. Okay? And black women are also more likely to present with advanced stage disease, often due to delayed diagnosis. Okay? And we have to talk about the inequities in access to care. All right? So scientific data does show that the aggressive patterns in many black women is biological. Okay? So there's a higher prevalence of these mutations and the markers that are linked to poorer outcome. So you have that, right? So that's already a disadvantage to black women. And now when they're looking closer now, they're finding out that most of these things that would make these cancers more treatable with immunotherapy in black women is less responsive. So biology plays a significant role, not forgetting the systemic factors, okay? All right? Let me go over some of these risk factors with you. Obesity is a risk factor. Diabetes and high blood pressure, which is both prevalent in black female population, compound the risk. I talked about nulliparity before with breast cancer and ovarian cancer. That means never having given birth. Late menopause also. All right. Hormone replacement therapy, which is literally what's called unopposed estrogen, and medication like tamoxifen can raise your risk. And there's certain genetic syndromes, such as Lynch syndrome and other types of syndrome that could elevate your lifetime risk. So knowing these things, and knowing what can increase your risk, your physician has to be aware of that and make sure that you get the proper workup and the proper screening. And watch what you do in terms of stress, hormonal intake, and anything that increases inflammation. The environmental factors. All right? So again, I'm appealing to black women, right, to undergo the appropriate evaluations. I'm telling the doctors, again, make sure that your patient gets the proper evaluation. If you have a postmenopausal woman that comes with bleeding, that's the most common early symptom. All right? Refer your patient with that complaint to see the gynecologist to get the proper workup. We need to continue to fight the socioeconomic barriers, okay? The mistrust issues that I have talked about ad nauseum, all right? And we just have to understand these implicit biases in healthcare. And we have to break some of these walls ourselves. There's different types of endometrial cancers that I'm not going to get into, but I have put out that it's most prevalent in Black women, and it's diagnosed late, right? So what we need to do is focus on early detection, all right? Look for the uterine bleeding, look for the pelvic pain or pressure, right? Unusual vaginal discharge, unexplained weight loss. All these things are important. And if you have a system or you're developing a system, make sure that you have transvaginal ultrasound. You can do endometrial biopsy, which is the gold standard, right? And CAT scans, MRIs. Let's start looking at these things and stop waiting for folks to do things for us, all right? Make sure you have qualified surgical personnel, right? If you need to do a hysterectomy, right? And if you need to do a lymph node sampling and all these things, right? Chemoradiation, right? We have to develop these things, guys. We need to stop waiting for what's not coming and develop our own, all right? So prevention and awareness is key, and we need to continue to educate each other. Let's expand access to gynecologic and oncologic specialists and doctors. Heed the call, spread the word, educate, and advocate. Have a great day. Peace.